My name is Dr. Brian Prostowski, and I'm a pediatrician who works for Sutter Medical Group of the Redwoods in Santa Rosa. I also teach for the Sutter Santa Rosa Family Medicine Residency Program at Santa Rosa Community Health, where I previously worked for 8 years. These videos are a 3-part educational series for healthcare providers, the first of which is going to give you some background information and recommended resources that I often use in my vaccine hesitancy discussions with parents. The second video will walk you through the expected visit flow to a vaccine hesitancy discussion, and the final video will be me role modeling a vaccine hesitancy discussion with the hope that you'll feel comfortable, prepared, and organized by the end of this training to be both a spokesperson and vaccine advocate. Because I am a pediatrician, every one of my patient visits includes a discussion about vaccines. Sometimes the discussions are easy, and parents are eager to get their children vaccinated in accordance with the routine CDC schedule, and sometimes parents have a lot of questions, which are mostly fear-based. It's important to remember that not all vaccine-hesitant parents are on the extreme end of the spectrum, i.e. a vocal vaccine refuser. The vast majority are willing and eager to be educated about why health professionals believe that vaccines are safe and effective. Remember that studies show you are their most trusted source for accurate health information. For more information that might help you feel more informed as a provider about vaccine safety, please visit the Vaccine Education Center through the Children's Hospital of Philadelphia. Dr. Paul Offit is our pediatric version of Dr. Tony Fauci. His vaccine safety related Q&A sheets are 2, maybe 4 pages max, and they're accessible at a link below in the description of this video. Make sure you scroll down to the middle of the page to see specifically the vaccine safety related Q&A sheets. Once you arm yourself with information, it's much easier to listen to your patient's fears about vaccines without feeling defensive or insecure about your own knowledge and whether or not you are the best spokesperson to provide them with medically accurate information. Regarding SARS-CoV-2, the daily onslaught of information is pretty overwhelming for patients, and the scientific data around vaccine acceptance shows that if you overwhelm a person with information, they are less likely to be interested in getting vaccinated. A measles vaccine study found that the more fear-based information you included in your discussion with patients, the more they were scared about both the vaccine and measles disease and wanted nothing to do with either. I encourage you to read the de Beaumont Foundation link below to get an idea about how to communicate effectively with the most vaccine-hesitant populations in America, and read their Language That Works to Improve Vaccine Acceptance Communications cheat sheet with specific scripts for approaching vaccine hesitancy discussions. Their organization website is www.changingthecovidconversation.org. A recent KFF vaccine monitoring poll, which is an ongoing research project tracking public attitudes and experiences with COVID-19 vaccines, showed that your most convincing messages to your patients will highlight vaccine effectiveness at both preventing illness and providing a means to a return to normalcy, rather than really focusing on data about rare allergic reactions or side effects. They found that when a patient knows someone who's been vaccinated, it makes them much more eager to get vaccinated themselves. I'll also try to link this study in the description of this video below. If you remember nothing at all from what I'm trying to tell you in this first video, it's that trust is extremely important with vaccine hesitancy, and sometimes even more important than data. You might find instinctively during your visit that you may not be the most trusted person, particularly to improve vaccine confidence for your patient. You might, in that scenario, decide that you have a more useful role to actually educate whomever you identify to be that trusted individual in your patient's life, so you can empower that person with knowledge to be an effective spokesperson for the patient. For example, it could be the primary care doctor, it could be a family member, it could be a faith leader, it could be a coach, it could be a teacher. At this point in the pandemic, it's all hands on deck, and these 3 videos are my attempt to fast track your education to prepare you for vaccine hesitancy discussions with your patients. In my next video, I'm going to walk you through an expected visit flow for vaccine hesitancy so that you can anticipate the direction of the visit and prepare your patient to be more informed about coronavirus vaccines. For more information about tiers and vaccine distribution in Sonoma County, visit www.socoemergency.org/vaccine.